It's been a long afternoon, and I think we want to, really hear some more of what our guest speaker has to say. But I do want to say it is really quite a remarkable gathering. And I particularly want to thank Kathy and Beverly for helping to pull this together. And to all the participants on the panels, when you look across both the level of conversation, the interaction with the audience, the kinds of ideas that were introduced, I mean, it demonstrates not only how global mental health is an enormously important issue in and of itself, but also how it can reflect back upon what we in the United States need to be thinking about with regard to how we design our own systems, how we get better representation and involvement and prioritization of mental health here in this country, not just in thinking about other countries. And it's amazing what we can learn both from our experiences on an international level, as well as to bring those experiences that we have domestically to the broader international stage. I think the other thing that I think struck me was not only the depth of interest that people have in global mental health, as demonstrated by the kind of people that were here and the number of people that have really wanted to be enthusiastically involved with the Global Mental Health Initiative here at Columbia, but the degree to which it integrates so many different perspectives, so many different disciplines, so many different levels of training from, very, early people in healthcare who are sort of just at the beginning of their training up to the most senior people in our department and in the university. So it really captures the imagination of a wide group of people across multiple disciplines, and not just disciplines from the traditional health kind of areas, but the ideas that are coming through come in the area of economics, of policy, of industrial engineering, sociology, a much broader kind of array of disciplines and thinking gets put into play. And I think that's really what excites people about global mental health, because it's an opportunity to play in a kind of a sandbox with all kinds of interesting ideas, all kinds of really important intellectual stimulation, but importantly, to also make a difference in the lives of individuals. And I think it's that kind of opportunity that really attracts people. And that's one of the reasons why we collectively, and I think it's in collaboration with the Mailman School and multiple other parts of the university, have developed a global mental health initiative here at Columbia. Kathy and a number of other people have taken a real major initiative in developing that. Many people are here in the room. And what's important is not just that we are able to sort of pull these kinds of strengths together here at Columbia, but we're also able to bring in other people from all over the world as well as all over the city. And I think that's really important. I should I don't know if Kathy already put in a plug for the Summer Institute.
Oh, I mentioned.
Yeah, but I think that people should take note of this, because I think it's really a terrific opportunity to actually get into more depth in an intensive way over the summer in terms of learning about global mental health. And because ultimately what we want to do is to bring together these disciplines, these strengths across the university and really make an impact. Which leads me to say something about our speaker and the organization she represents. Because when you think about impact, probably there's no other organization in the world, perhaps, that has had the incredible breadth and depth of influence that the International Rescue Committee has had in terms of an impact both domestically and internationally. I guess it originated in like 1933, stimulated by Albert Einstein, and has really evolved over time to have work going on in 40 different countries and I think 22 cities around the U.S. itself. I mean, it has a domestic program, it has an international program, it has impacts in education, it has impacts in really dealing with what some of the worst atrocities or real crises, humanitarian crises from around the world and in this country. And it's been able to bring together incredible resources of both professionals and also volunteers in this area. So Kathy, I don't know if you want to introduce our speaker, who's had really a very distinguished career in both not only the International Rescue Committee, but in a number of other areas.
So it's my pleasure, thanks Harold. It's my pleasure to introduce Sarah O'Hagan, who has worked for more than a decade as a board member, fundraiser, and advocate for nonprofit organizations. Sarah has been on the board of the International Rescue Committee for almost 20 years, I think, and has been co-chair. She started when she was 5, and she is co-chair of the board of directors for the International Rescue Committee, which I might just add parenthetically, the president of the IRC for the past number of years, I think almost 10 years, 11 years, was George Rupp, who was the former president of Columbia University. So there is another tie between our global mental health initiatives, our Columbia efforts, and the IRC. But the reason that we invited Sarah to speak today is largely harkens back to the comments that have come through on the panel that we can't do this work alone, and we need to become more aware of and more connected to the other organizations that are approaching similar problems from a different perspective. And Sarah, as a leader from the IRC, her leadership with the IRC really embodies just that. She, in her own profession, actually, during the 1980s and 1990s, worked in print and television journalism. And I think that is significant in the sense that Sarah's been a master of bringing together different areas of expertise, her own expertise and that of others, to really make the difference in the lives of many, many people. So it's, Sarah and I are walking buddies, and walking around the reservoir in Central Park, we've had lots of discussions about how we're going to, make the world a better place, and we always come back to these points of intersection from the initiatives around global mental health and the IRC. And so it's really a delight to invite Sarah this evening to share with all of us more about the work that she does on behalf of the International Rescue Committee. Thanks for being here, Sarah.